Uterine fibroids are the most common reason for hysterectomies in the United States. As many as 30% of women suffer from these benign but painful tumors. Dr. Frank Saraceno of Boca Raton Regional Hospital joins us now to tell us much more about this. Doctor, thank you so much for joining us.
Thank you, Mike.
What are uterine fibroids and what causes them?
Uterine fibroids are tumors that typically occur in the uterine wall, and they're caused by an abnormality in the genetics of that cell. The problem is that these tumors can occur in the uterine wall and cause bleeding or pain, and they're quite prevalent.
And you know, talking about how common this condition is it a common condition?
Well, the prevalence of fibroids in women is estimated to be about 50%.
Wow.
So by age 50, the majority of women have some type of fibroid tumor.
Sure, and I'm sure someone listening right now would want to know what the signs and symptoms are. What's to be looked out for?
Well, heavy bleeding, pressure, pain, generally in the pelvis, increased menstrual flow. Those are typically the signs or symptoms, and the most important thing to recognize is that that collection of symptoms accounts for the majority of office visits and eventual surgeries that are performed.
Okay. Talking about treatment here, what is the most common method for treatment?
Historically, the majority of women undergo hysterectomy procedures. Usually 2/3 of women with symptomatic fibroids will have a hysterectomy procedure in the past.
Okay, and I believe we have some things right here where we're talking about the treatment.
Well, more recently, there are other techniques available, so a procedure that actually shaves away the fibroid tumor may be preferable to actually removing the uterus, and that can be done using this newer instrument called the MyoSure.
Okay.
This is a patented instrument that allows us to introduce a 3mm probe into the uterine cavity with a little shaving device at the tip. And that shaving device is activated to rotate and shave away any irregularities in the uterine wall that can cause bleeding or pain. Typically, those irregularities may be fibroid tumors or uterine polyps.
I see. Okay, and this is relatively new, or this is?
It's quite new. It's been on the market or commercially available for a little over a year, and it allows us to go ahead and reduce the bleeding and pain associated with fibroids by clearing the cavity of fibroid tumors or polyps.
I see, as we're taking another look there.
Yeah, so you get a close-up look here.
Sure. And just any kind of symptoms, perhaps there's some things that women can do to make sure they don't go down this path or have to experience this.
Well, the majority of fibroid tumors are hard to predict. When they do occur, women can seek attention with their physician, and hormonal therapy can be attempted as an alternative to try and reduce the risk for bleeding and pain.
Okay, outstanding. Doctor, thank you so much for joining us on Boca Raton Regional Hospital. Sponsors are Expert and underwrites our Ask the Doctor feature.
Ask the Doctor is sponsored by Boca Raton Regional Hospital, which provides the physician for this segment.